Hi YouTubers and YouTubies, part 2 of the pre-op orientation and what you should know. The last video was about troubleshooting post-op issues. This one is going to be, while in the hospital, what your diet should contain. This is the video you're going to want to have with you if your hospital is not a bariatric surgery facility or bariatric friendly. Some people have the surgery and the doctor goes to the hospital to do the surgery. The hospital is not set up for bariatric patients. So there are patients who actually have to tell people while in the hospital that they can't have potato soup or a hamburger or something. And these, the person who's bringing in the tray has no idea what a bariatric patient should have because the facility isn't set up that way. So you're going to have to know if your hospital does not provide bariatric friendly recipes. This is pretty much across the board what you're going to have when you're in the hospital post-op surgery. Okay, so you're going to be, for most of us, the doctor would require some sort of a liquid diet, usually a clear liquid diet prior to surgery. I have to do a 3-day clear liquid diet the day of surgery, nothing from midnight to the day of surgery, and I will not get to eat anything until 8 a.m. the day after my surgery. So that's almost a day and a quarter that I have to go without anything in my stomach. And I don't know, after surgery I might not be even hungry, but prior to surgery I'm probably going to have a grumbly belly, and I'm not too crazy about that, but I'm also not crazy about doing a clear liquid diet either. But most doctors require 1 to 3 days of a liquid diet, and it's usually a clear liquid diet. Post-op, you should also be receiving a clear liquid diet. It's the only way that they're going to be able to tell if you have a drain. I'm going to have a drain, I was told, if your stomach is draining. If you put food in there, like a hamburger, or let's say green beans in there, or they want you to eat some mashed potatoes up or something, your stomach can't handle that. It's not going to be able to understand what it's doing, and you're probably going to vomit a lot. So you got to go in stages. So pre-surgery, most people have a liquid diet. Post-surgery is the same diet, basically. But for those of you who don't have it, this is what you should be doing to be healthy. Okay, it says, directly following surgery, it's important to stay hydrated by drinking only clear liquids. Hydration promotes proper healing. Sip as tolerated and sip often. So don't swallow big swallows of fluid. You're going to want to sip a little bit because you don't know how much your stomach can take. You don't know how frequently it can take it. So sip, little sip, and if it's okay, sip again and keep sipping. Preferably, you're supposed to have 64 ounces of fluid a day of water, just water. So you got to try to get to 64 ounces in, plus these meals and these protein snacks in between, because you're going to have all these you get to eat all day now. that's one of the joys of the surgery, where on our diets prior to this, we were always told you can only eat a certain amount of time, certain amount of food. Well, you get to eat all day, but you got to eat healthy. So one of the things you have to do is 64 ounces. Okay, so you're going to sip as tolerated by the tummy and sip often. Clear liquids are the only foods you will receive while in the hospital. Your hospital should only be giving you broths, sugar, there's my mail again, sugar-free JELLOS, anything that you can see through without it having any carbonation in it, because I know if some of you will go, well, Sprite is clear, true. Orange soda's clear, true, but it is not healthy for you. You can't have that in there because you're just after surgery. This is while you're in the hospital, remember? So while you're in the hospital, nothing that is not clear and not healthy for you. So you're going to have clear liquids most of the time. You will continue to sip on clear liquids from now on to ensure hydration. As I mentioned, you have to have that 64 ounces of water at least a day. The diet starts while in the hospital, approximately 24 hours after surgery. So, well, if I get to have something at 8 in the morning the next day, I guess I get my surgery at 8. I don't even know yet. I don't even know what time I'm having my surgery yet. I was supposed to find that out this Friday. Daily meal plan or pattern is 64 ounces of fluid. vitamin and mineral regimen, True or Crush all vitamins. I have to have an adult multivitamin twice a day. I need an iron pill or supplement of some sort, a chewable iron pill, 36 milligrams daily. Vitamin C, 100 milligrams daily. Allowed foods, this is for your liquid diet. Water, naturally. Sugar-free gelatin, as mentioned. That would be the JELLOS. You can go get generics, and they're fine. You could pre-do some of this while you're, right before you go to the hospital. You can make some of this, because you're going to have to do this post-surgery, too. Low-sodium broth, already got that. Flavored non-carbonated water. So you got to make sure when you're looking at your water bottles that they do not have carbonation in them. I just go get water bottles and add my own flavors to them, like Crystal Light, and then I have them sitting in the refrigerator waiting on me. So that's a tip for you. Sugar-free drink mixes, I just said that. Decaffeinated coffee and decaffeinated tea. The caffeine in the tea will irritate your stomach, so you don't want anything with caffeine in it. You want to take that out. Choose fluids that have no carbonation, no caffeine, and no sugar. The sugar will make you get sick. The caffeine upsets the stomach, and the carbonation is just too much for the tummy to hold. Too much fizzy stuff. The reminders are you want to sip slowly. Stop sipping if you feel full or nauseous. When in doubt, wait. You're going to have to wait to see if anything happens. If you feel nauseous and you feel like throwing up, well, if you got to, then you got to. You just got to do it. Then you want to take note and see if slipping slower or smaller could help that. So you want to make sure if your stomach can't tolerate when you do it the right way, maybe you don't like that thing. Maybe the stomach doesn't like that. Never ever force yourself to finish food or a beverage. Continue sipping when the feeling of fullness goes away, and right after surgery it's going to be difficult. But they're going to monitor you if they're a good hospital prior to surgery. For me, I've got to walk 3 times, and I think I have to take 1 meal in before, or roughly the amount of fluid. I'll have to pee for them, too, before I leave. Before they let me leave, I've got to do certain things, and that's a good hospital that wants to make sure you're doing the right thing. Only consume beverages that have 4 grams of sugar or less per serving. Try no sugar. That's even better. You don't need the sugar, so try no sugar if you can. If it comes with sugar, like juices, natural juices have sugar, so you're going to want to make sure that your juices are lower. And that would be 4 grams of sugar. For a boost of protein, mix unflavored protein powder, Benefiber. Beneprotein is what they're talking about here, which is one of them. The Bariatric Fusion, I have this on the other one, is unflavored, and it could be mixed with anything. So, and I have it right here to remind me that I have to do it all the time. So it's right beside me all the time on my desk. Beneprotein, which I think you can only get online, I have not actually looked that up yet, is another unflavored protein powder, a lot like that one that I just showed you. You can add that in liquids, you can add that in foods later on, like your pureed foods, and when you get a little bit further along with your foods that you got to chew to get the protein in, you can always add more protein. I said that on my last video. More protein. You don't want to do less. If you experience nausea, vomiting, or other problems during your recovery, you can always return to sipping clear liquids. I mentioned that on the other video too, that you can always go backwards. Do not go forwards until you're allowed to. You'll really end up doing some damage until your symptoms subside. So that's the hospital stay. That's what's going to happen to you when you're in the hospital. So I want to go ahead and end this video so that this one is just by itself and there's nothing added to it. Keep watching. I got more videos to come. Every little thing that I'm talking about, this pre-orientation that I learned, and this is only part of it. I have a whole other book I have to go through. So anyway, pre-orientation, what happens in the hospital. Thanks for watching. Bye.